I'm Barb Summer, and I'm sitting here today with Dwight Maxa. We're doing an oral visual history interview for the Commission of Deaf, Deafblind, and Hard of Hearing Minnesotans Oral Visual History Project. It's June 8th, and we are in the Golden Rule Building in downtown St. Paul in the offices, the Commission offices. And so with that introduction, I would like to ask Dwight Maxa, if you'd please introduce yourself, and we'll go into some questions.
Okay, my name is Dwight Maxa, and I'm here to talk about the beginnings of the Deaf and Hard of Hearing Services Division and the Commission.
Thank you very much. Would you start, please, by telling us how you became interested in or involved in or started looking toward becoming involved in the Services Commission and the work that you do?
Okay. The beginning goes back to about 1976, and my past history was that I started out as a teacher and then became a special ed teacher and then became a special education director, and I was just in the throes of completing my doctorate at the university, and I had heard about this job, and so I contacted the state planning agency, and the fellow there that was in charge of this project, his name was Dean Honenschlager. And the background is that Rudy Perpich was governor then, and some people from the deaf community had contacted the governor and explained to him that services really weren't up to par for deaf people. In fact, they were pretty much non-existent. And I don't remember everybody, but I remember that Bob Harris and John Scanlon, who was a psychiatrist at Regents Hospital, and I think Sonny Sonnenstrahl, Jerry Nelson, and it's hard to do the names because I know I'm missing some, but anyway, this group of people had lunch with the governor at the governor's mansion on Summit Avenue. And they talked about, I was not there, they talked about the state of services, and particularly that there was very little available in the rural areas. And I have to give the governor credit. I knew him personally, and he was a man who really cared about underdogs and wanted to do something. And so he approached the state planning agency, which at that time was really an arm of the governor's office, and asked that something be done. So there was a 2-year study which was for the purpose of looking at how services were delivered and looking at how rural services might be delivered to in a sparsely populated area to a group of people who were way less than 1% of the population. And so that project was given to the state planning agency. I think it was funded by the governor's office. And then that's where I came in. I was the person that was chosen to do this study. Prior to doing this study, I didn't have a lot of background in work involving deaf people or people who were hard of hearing. When I first talked to the deaf community, I remember I went to a meeting over at MADC at Thompson Hall, and I had to give a little speech. And when I told them that, well, you know, when I was born, I was deaf in my left ear, and it caused me a lot of problems in school because in those days there weren't audiology tests, and people, you know, didn't really pay attention to it. But I was in about 8th grade before they finally figured out I couldn't hear very well. And then my hearing started to deteriorate in my right ear later on in life. But I remember when I said that, they all clapped, and they were so glad that somebody was doing the project who had some limited understanding of what it would be like to be hard of hearing or deaf. When the study was designed, it was set up so that, you know, there was a fair amount of research done, and I was the researcher. But in addition to that, it was also designed so that there could be adequate input from the community. And there was a lot. There were, I can't remember, you know, all of the details, but there was a large group of people, there was a large advisory committee, and they had representation from all over the state. And the thing that strikes me about that is how committed people were. And you had deaf people, and you had mothers of hearing impaired kids, and you had adult people with hearing disabilities. And they would drive, from places like Brainerd and Fergus Falls, just so that they could offer input. And they did it not once, but several times over a period of 2 years. Now, what evolved from that was something called the Committee of Nine, and those were people who came from that larger committee. And I would think there was probably maybe 25 people on the large committee. And the Committee of Nine was a legislative arm that was put together so that they could contact legislators and tell the story that was evolving about the fact that there were few services and something needed to be done.
So talk a little bit about your study then.
The idea was that if you're going to have legislation, then it has to be supported. If it's something that you want to take to legislators and you want to lobby for and get advocates involved, it's got to be based on good information. And so we worked with Gallaudet College, we worked with the Census Bureau, with the Center for the CDC, the Center for Disease Control, and several other medical groups, including the University of Minnesota Medical School. And we asked questions about the prevalence, about the incidence of deafness and hard of hearing, especially with the school-age populations. And we even went so far as to lay the information out in age cohorts so that you had 0 to 5 and 5 to 10, 10 to 20, and so on, even up through 85 plus, so that all we did is gather the best available information. It may not have been perfect or exactly correct, but it's all we had, and it was a composite of all those sources. So when it went to the legislature, they were pretty impressed that we had taken the time, and we could cite not only one source but many.
And that study then led into what became the Legislative Commission on the Hearing Impaired.
Right.
Is that correct? If I got that?
The Committee of Nine lobbied the legislature, and we identified legislators that had history of helping other areas like blindness and physical handicaps, so that we actually explained to them what we found, explained what some of the service needs were, and then asked them to support a bill which I wrote at the State Planning Agency. And that bill was the Hearing Impaired Services Act. And it went pretty well. Our strategy from the beginning was that we would work with a bipartisan group. And this was 35 years ago, and the political climate was much different. And there were people who really wanted to do the right thing. And I just didn't see the kind of political infighting that we see today. It was hard to find the difference between a liberal Republican and a conservative Democrat. And that was kind of the coming together point. And so we actually enjoyed pretty good support for what we were doing. And it's never easy to get a bill passed like this, especially a bill that has what we call tails. In other words, if you pass it today, you're going to be living with it 20 years from now. And that came up. I mean, legislators were concerned about, well, what is this going to cost? And what's it going to look like, in 5 years or 10 years? But we were able to convince them that, it's an important bill and it needs to be passed. And it especially needs to be passed because the people that it affects are not getting equal services. In fact, back then, there were cases where if you were in a hospital and you wanted to understand what was happening, you had to pay an interpreter to help you, or you had to use a family member. If you used a family member, oftentimes it was a child, and then it put the child in a very difficult place, and you may or may not get accurate information.
But the Hearing Impaired Services Act it took a lot of work, didn't it, actually, to get it?
Well, yeah, it did, and I think if there was a contribution that I made, it was writing a good bill. And I had a lot of help at the State Planning Agency. And in fact, I mentioned, or maybe I didn't, Dean Hohenschlager was the person at the State Planning Agency who was my boss. And coming from education, I didn't know all that much about state government, but I learned in a hurry. And he was really good to me. He helped me learn how to work the system. And that's really oftentimes what gets missed with advocates when they bring legislation in. So the governor had asked us to put together a model that would allow for service delivery in rural areas. And so the idea came up that we would have regional service centers. And that was an important part of the bill. And at the time, it was new thinking. There were other states that were planning legislation like this, but they never quite developed their thinking to that extent. And so the legislation allowed for 8 centers and a division that would oversee services and would act as a liaison with the State Department of Human Services.
And that became what, the Deaf Services Division? Is that correct?
That eventually became the Deaf Services Division. Okay. And actually the division was, or the program was formed in 1978, but it wasn't a division. It was just a program, and people weren't, the people in government weren't quite sure what to do with it, and they didn't particularly like it either, that here's one more thing they had to do, and with not enough money. Wisely, the legislature had phased it in so that the first couple years we were to put up 3 centers, and then 6 centers, and then 2 more after that. So it was like a 4-year phase-in. And that was a good thing, because I think if we would have tried to do all 8 right away, we would have failed.
Really?
Because it's so hard to find, well, back then it was really hard to find good staff. And that's the key. You know, you have to have people who really have a background in deafness or are deaf so that they can lead others. And part of the regional center concept was that the centers would work with counties, and it would be like a technical assistance project. They would teach the counties things that they needed to know in order to provide equitable service.
How large were in terms of staff and stuff, were the regional service centers? And I know, or what did you think would be an appropriate level of service?
Well, when the bill passes, they usually pass some money with it, and then they pass whatever they think positions are needed to get the job done. So I remember at the beginning, I think we had a staff of 3, but yet we had the mandate to do these centers, and we couldn't really do them because they didn't give us the staff. So it was like that. I mean, nothing ever starts easy. And so it was every year going back and explaining and asking and explaining. And I will say that the legislators that we worked with were good. They were good to us, but they wanted assurances that we were going to do what we said we were going to do, and they didn't want any failures. And so it all evolved over time, and we started with 3, and I don't know how many are in the division today, but I think during the end of my tenure, I think we had 25 people.
In the Deaf Services Division
Yeah.
of the Department of Human Services.
Yeah.
So that actually was, what was the role of the Deaf Services Division then? To oversee the regional service centers, but also to look at more of a statewide approach? Or
and I don't even know if I can remember where they were, but Fergus Falls and Rochester, St. Paul, they had one for the metro area here. There was one in Duluth, I think one in Two Harbors, and I think that's all I can remember. Yeah.
But then the Deaf Services Division itself, the mandate was to as you started to develop it then, was to start to look at the state overall as well, or talk a little bit about the Deaf Services Division.
One of the things that we were being held up to for comparison was Services for the Blind. And they did a lot of things, and we actually patterned ourselves after them for a period of time. And we also, at that time, the human services part of it was help with social services, help with child support, Medicaid, Medicare, those kinds of issues, because that's what the Department of Human Services does. So the technical assistance and the interface with those services was through the division here in St. Paul. The rehabilitation, what we call DVR at that time, that was done separately. And so we would refer, and that was a big job for the regional centers and for the division, to constantly be referring people to different services. It was a central entry point. In fact, I think that language was in the bill. Central entry point. And that way people deaf people and hard of hearing people could come there, come to the center, and they would be referred, and then we'd have like a case manager that would go with them and troubleshoot problems. And I think that's less of an issue today, but at the beginning, that was really the main purpose and the main methodology of how we did things. It's interesting to note that about, I think, 4 years into the program, into the creation of the program, we felt that we should combine vocational rehabilitation and our division. And so there was legislation that addressed that, and the legislature made the decision to take resources from the Division of Rehabilitation and bring those together, and that increased the size and the budget of the Deaf Services Division considerably.
And why did you decide to do that?
A comment about that would be that at the same time that we were doing this work, other states were doing it as well. And there was a movement in the country to find a way to equalize things, and some of the federal legislation that passed, like the ADA, and that was a big factor. But what I want to say is that I think one of the key things for Minnesota was the placement of the services. And I know that there were states where the legislation passed, but it never quite got any traction. And then then in a few years it was gone. And the reason I think it got traction is because we were able to put the division in one of the largest state departments, if not the largest state department, where we had a lot of people that were willing to help us and to teach us and to show us how to do things. But having that status, the status of being a division, helped us with the legislature, because we weren't reporting to the mental health division or to the social services division. We were seen as an important part of government. And I noticed that when I did a follow-up study after the Hearing Impaired Services Act, and I looked at how other states were doing. And I noticed that the ones that had failed in that regard. They had ended up in some small corner of a social services division or part of vocational rehab, and they never had the status to really pull themselves up. And we did pattern ourselves after Services for the Blind, because they, too, were a division and kind of a important part of the department they were in.
And you had visibility that way. You had a lot going on.
We had credibility with legislators that we wouldn't have had otherwise. I need to grab some water here.
Yeah. Yep. Okay. Are you? And as that started to grow and you started to have the regional, what were some of the needs that you felt you were critical, say 35 years ago? And we know things have changed, but what were some of the needs that you felt were most critical that you, through the Deaf Services Division, wanted to see help being given to?
Well, I think two things. One was the communications at all levels. And now with all the services that we have, including caption TV, you don't you take it for granted. But then there was no captioning and no one would pay for it. And that was a hard fight. And I think the commission really was instrumental in getting that done. But if you went to a hospital for services, there was always an argument about who was going to pay for it. Or even if you went to a welfare department, like if you were in Ramsey County and you went to Ramsey County Services, they would argue and say, we don't have to provide an interpreter. And they were, of course, wrong. And it took several years to teach them that they were wrong, because you could go in and tell them and say, you know, you really can't do that. And they'd say, yeah, well, too bad, we're going to do it anyway. So it took, you know, many years of kind of badgering and cajoling and showing them the legislation to get them on board and to get them to really not just do it, but to embrace it. And so it was just trial and error, and just you had to be very tenuous. The other piece was it escapes me now.
Yeah, communication. People talk a lot about communication.
Yeah.
But go ahead. Is there another one that you?
The part about what I'm trying to say here is the people themselves had real needs, not just communication, but they had issues like just being left out. I remember in those days, for example, deaf people who graduated, many of the guys ended up in printing shops because it was so noisy and loud that it just was assumed, well, if you're deaf, then you'll make a good printer. And, you know, we kind of laugh at it now, but that was really the case. And so that was another area that opened up, was the division worked hard to teach employers what advantage there is to hiring someone with a hearing impairment. And the same with schools. The children oftentimes weren't taken seriously because they maybe had a mild hearing impairment, or maybe they were actually deaf, but the school didn't know quite what to do. And so the division was again in a teaching role. So I guess the two-part thing would be the communication, and then to address the real needs of people who had disability.
And almost fighting, is it a stereotype or something that you're fighting, or not? Or is that a wrong way of describing it?
Yeah, I think it was a stereotype.
It's changed.
Things have changed so much, I've completely forgotten that was a problem, but it was a problem, yes.
Well, and from that work, then you also started moving toward the development of the Commission for Deaf, Blind, and Hard of Hearing Minnesotans, which started out, as MCHI, perhaps? Is that correct? Minnesota Commission for Hearing Impaired, or is...
Right.
How did that get... a little bit about that.
Yeah, can I go back and just say one other thing about...
yes, definitely.
On the communication side, now we have email. But I remember when I first started, I was given a TTY machine, which was an old teletype machine that had been converted for use by a person by the name of Gordon Allen, who supplied many of us with these machines. And I had one in my house and I had one in my office. And it was really this big. I mean, it was like 5 feet across and about 2 feet in depth. Amazing. And that's what it took. We had to sit there at the keyboard and, type and clunk, 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 It was, it's hard to imagine that it was really that bad only 35 years ago. And of course now things have completely changed, but the point is that communication was a big thing as far as people trying to order a pizza. How do you do that? You'd have to find somebody that can use the phone, maybe a friend or whatever, and have them do it for you. So I wanted to highlight that part.
Well, and safety issues would have been a factor, I would think. And you know,
That too, of course, yeah.
How do you deal with a tornado alert?
How do you dial 911 when there's nobody that has a TTY? Yeah. That was true at one time.
Mm-hmm. In fact, I think you were quoted as saying once that most people got telephones in 1910. In 1975 is when we started seeing them come into the community.
Well, regarding the commission, the way that came about is kind of interesting. By that time, the division had been lobbying the legislature, and like every year, trying to get a little bit more resources so we could do the job they already gave us to do. So we were pretty adamant about working and just not giving up. And at one point, some of them got kind of tired of us. And they said, you know, you need to define your role here as a division. Are you an arm of state government? Are you a division that provides services to people, social services, and all of the other things that people need so that they can enjoy the same level of support as everybody else? We don't see where, according to you being in the State Department, how you can be here lobbying. And they were absolutely right. They caught us because we were doing way too much lobbying. And so that's actually, when that happened, that's about the time the idea came along that what we need here is a commission so that their sole purpose is to work with legislators and other policymakers so that they can develop a better understanding of what people need. And it was a huge success right from the beginning because they kind of had no holds barred. They could go out and do what needed to be done. And we always had to hold back a little bit because we had a kind of an identity crisis.
You represented the DHS on the commission, as I understand it.
You know, I really don't remember much about it. I know it was very small at the beginning, and I really don't remember who was on it even, except for Kurt Mitschke, who came to be the director and a very good one. There were different deaf people that were brought in and taught how to approach legislators, and of course that was another thing where other disability groups, because speech wasn't a barrier or hearing wasn't a barrier, they kind of automatically knew the drill and what to do. But our constituents didn't, and things had to be taught and broken down and explained. And I think everybody has seen this big chart that Bob Cook drew about the the development and implementation of the Hearing Impaired Services Act. That was actually a teaching tool more than anything. It was a visual tool so that people in the deaf and hard of hearing community could look at that and understand. So it wasn't necessarily for show, it was a teaching tool.
And so that's what you were doing, was actually, as you began, was to begin to teach people how to advocate.
Yeah, we started with nothing, and then people who expressed an interest in wanting to work with legislators gradually began to show up. They gradually developed skills, and good skills, in how to present their argument. And I think they're still doing it today, too. You know, the people come and go and their energies burn out, and you've got to get more people, and it's a constant struggle, but that's what it was all about, was, you know, the teaching and then go forth and do.
And then in that case, were there any areas where you felt the commission really, you know, needed to do its work? Any specific areas of need in the community that you saw
that the commission
take hold and work on?
Yeah, well, you know, they've been responsible for just a whole bunch of legislation that they have created, and I know most of the interpreting laws that we have today are a result of the work that was done by the commission. I know that there's an infant screening bill that was just passed a few years back that requires that all hospitals screen newborns for deafness, and that was something that they did. Having been out of the field for a while, I don't remember all the other things, all the other issues and needs that have been taken care of, but I do know there are many. It's just such a evolvement of things that at the beginning everybody was happy with having an interpreter, but then they soon realized that an interpreter that works in the court system and one that works in the hospitals and one that works for social services, that one person might not be adequate to cover all those bases. And so the commission went to work and developed legislation that would require those providers to have qualified interpreters, and then at the same time had to back up and work with some of the training institutions here to provide the classes necessary so that could happen.
Development, as you asked about the development of the mission, and then you mentioned how you separated, and let's talk a little bit about that.
We had gotten criticism that the division was just going too far into the political world, and so the commission was really created so that it could do the interfacing with policymakers and lobbyists or legislators and so on. And at that point, we made a decision to separate ourselves from the commission because we had to. So I did have a presence at the very beginning, and I was there, but I phased myself out as soon as I could because they really needed to operate independently. There are several, again, it's placement in government that's important. There are several places, or there are several ways you can do the work. You could be a committee. You can be a commission. You can be probably 3 or 4 other things. But the commission was really the highest level, and it was not easy getting that passed because the legislature was very reticent about wanting to have another commission. And commissions they have more power and they're listened to, where a committee, maybe not so much.
Oh, it took a little work?
Yeah, it actually didn't pass the first year. I think it took 2 or 3 years to get that word in. Yeah, the word commission.
And to get the support for it that way.
Mm-hmm. Right.
But you stayed the course. You didn't say, no, we'll accept committee or we'll accept something else.
No, that was not an option for the deaf community. They were absolutely convinced that that's what needed to happen, and they stuck with it, and it did happen.
Yeah, it did.
And actually, as time passed and the commission became more independent and more just better at what they did, we had a number of cases where our division didn't agree with the commission, which is inevitable. That's how it is. And that's a good thing. So, we, at the end of the day, the division has to support the Department of Human Services, and they have their mandates, and they tell us what has to happen. But that may or may not be in the best interest of the people we serve, and so that's where the commission comes in. They're there for the purpose of making known what the needs of the community are. So they're 2 different roles.
Is the commission more of an advocacy organization?
Absolutely.
Okay,
it is 100% advocacy.
So you see it out there, maybe identifying issues that need to be dealt with, being active in working with the community that way? Right.
Again, that's something that evolved. A commission does just what you said. A better commission not only identifies the needs, but does the research to support it and writes the legislation so that it can pass, and then lobbies the legislators and educates the community. And that's what this one does.
So
they've done some excellent work. I think if I were to rank nationally, I think Minnesota's is number 1.
We asked about some of the other areas that the commission has been, or that where the needs for the community that obviously involve both the Department of Human Services and the commission. And we've talked about communication, and that comes up so that's so critical. But a little bit on education, and you've mentioned public education, outreach, that kind of thing. Is there anything more you'd like to say about that?
I think with education, there is a definite division between our work, or the work of the division of, getting confused with divisions here, the division of Deaf and Hard of Hearing Services. They have a role, and then there's the Department of Education, which has, of course, a role in educating children. The thing is that they set their own policy, and it's very difficult for us to tell them how it's going to be. We can advise them, we can offer technical assistance, which is what we did. But we didn't have any real authority over the policies that they set for youngsters and for high school and so on. There are some federal mandates that address that, but here again we go right back to the commission again, where they can recommend to them changes without any conditions, and they can lobby to make those changes happen. And the Department of Education doesn't necessarily have to agree with them. But our department here, we have no influence, or very little.
Yeah, and so actually what you're talking about when you're talking about changes in the classroom, you're talking about access to interpreters. What else are you talking about, or what kinds of things are you talking about in the classroom?
Actually, if you go back to the very beginning, deaf and hard of hearing students, I think hard of hearing were probably okay, but deaf students weren't necessarily mainstreamed. They were put into special programs for deaf kids. And then, of course, there was the state school in Faribault. So things have changed a lot, and now school districts have to mainstream students, and that means that there's a lot of exposure to interpreters and to sign language, and you've got other students who see that and want to learn.
Well, and ASL, I think, has been accepted as a recognized language. Wasn't there some work actually in that direction as well?
Yeah.
In understanding how the role of ASL and how it should be used in a school.
Yes, that's true. There was a time when ASL was a language that was spoken by deaf people, and no one really seemed to recognize the value. And later on, that's exactly what happened. It was recognized as a real language and treated accordingly.
Yeah, and so all of these are changes that have just, sounds as if there's been you've fought for, or you've identified, or you in a broad sense, people have fought for and identified and continue to work toward.
Right.
In all of this. The commission included deaf-blind. You want to talk a little bit about that, I think, and how that came about as well, and including that in the mission?
Yeah, fairly early on, one of the needs that came up was that the deaf and hard of hearing, the deaf-blind were pretty much left out of things. Even though we were making progress with deaf and hard of hearing people, they were sort of still castaways. At the time, the Services for the Blind was doing some work, but they didn't have the resources they needed to serve that population, because typically they didn't have any understanding of ASL or sign language or even signed English. And so we as a division made a decision to go forward and make it known that we wanted to work with deaf blind people and were willing to do what we needed to do. And they now come to us as part of that central entry point where they can be referred back for services that they need. But we have a long history with deaf blind people, and I think we were part of the original effort to get interpreters for deaf blind people. And I think you know that interpreting is done in the hand, obviously, because they can't see.
Yeah, and so that again was another area almost of education, I would think, as you tried to help people understand what was needed.
Right.
Yeah.
Yeah. They were misunderstood. They really didn't fit in, and there was such a small number that they never really got traction. But once we included them with the deaf and the hard of hearing and so on, then things changed.
Is there anything that you, as we've talked about this, we've talked about some of the areas that you worked with. What do you see the needs are? How would you identify the needs today, or talk a little bit about change, and then a little bit about the future?
Well, this is a hard one for me because I've been away for so long that I don't know that I can really talk about today's needs.
Okay.
I really don't know.
What
one thing I do ponder is the impact of email and how that's affected deaf people.
Okay. How it's affected. If we have about a minute left, would you like to comment on what you would hope for the future?
I think that, as I see it, people in the deaf and hard of hearing community are doing very well, and I hope things continue, and I hope that things at the legislative level are such that this program and the other programs don't go backwards. That's, I think, a real fear I have.
So that meeting at Thompson Hall when you received the applause early on has carried through your career, sounds like.
It has. I definitely like the work. I was kind of a long shot, I think, for someone to take on that project, but it all worked out, and I'm happy. I'm very proud of what's been done. I'm proud of all the people that are doing the work today and all the ones who gave contributions year by year. There's been many people that have left and some have come back, but it's been, from my perspective, one of the most satisfying experiences that a person can have. Although I don't know that I was a huge success financially because I was a state employee. I was excited then, and I still get excited about it now.
Thank you.